Beyond town meetings, March is National Nutrition Month, a time when we can turn our focus to helping ourselves and family feel and look great. The theme of this year's National Nutrition Month is Bite into a Healthy Lifestyle. YCN's Lisa Cannell met with registered dietitian and diabetes educator Virginia Morris to learn more about this important topic.
Hi, Virginia.
Hi, Lisa.
It's nice to meet you. And let's talk about your work today as a diabetes educator for Valley Regional Hospital, but I understand that you've done this work before.
Right. I'm a registered dietitian and certified diabetes educator. I've been in the field for almost 27 years now.
Okay. And this month is National Nutritional Month. How important is it for everyone to focus on their diet, what they're eating?
It's important for everyone. Very important. Different aspects of your diet, especially eating a variety of foods, different colors from the fruit and vegetable group, portion controlling, looking at food and nutrition labels, and at least being aware of what a suggested serving size is. I think it's Girl Scout cookie time, isn't it?
Yes.
Yeah. I know in my house, if the Thin Mints are going to last more than an hour, we have to look at what a suggested serving size is. So I don't feel that there's good or bad food. Mm-hmm. Food is just food, and it's portion control. And don't believe in can't. Okay. If someone's saying that they can't eat that, I like to tell my patients to change the word from can't, which sets up a feeling of deprivation, to choose. You choose to eat this, or you choose not to eat that. So.
And sort of like you mentioned earlier, one of your favorite quotes by Oscar Wilde.
Yeah, Oscar Wilde. Everything in moderation, including moderation. Okay. Yeah, you have to be honest with yourself. Some of the processed foods can fit, every once in a while in moderation, but as long as it's the exception, not the rule.
Okay. And the bill that was recently reintroduced in Congress by Senator Jeanne Shaheen of New Hampshire and Susan Collins of Maine, why are you watching this bill?
I'm excited about it because it's going to improve access to diabetes care, diabetes management, diabetes education, the information that's given to the public. And hopefully it will make it easier for people to afford diabetes self-management education, because it will, third-party payers, Medicare, Medicaid services will reimburse a bit more liberally, perhaps.
Okay. And getting back to National Nutritional Month,
right.
What are some of the biggest misconceptions about type 2 diabetes?
That, again, you have to be following a very strict diet, that you cannot go out to eat or have an occasional sweet, that if you have type 2 diabetes for 8 to 10 years and your doctor tells you that it's time to transition to insulin, it doesn't mean that you failed. After a while, the pancreas just doesn't produce the same or the adequate amount of insulin, so that's just a natural progression of the disease.
Okay. And something else about this topic that I haven't asked you that you would like people to realize and think about each day when they choose their meals?
Like I said, variety, trying to eat at home more often, family meals, rather than dining out. You have a little more control over the ingredients. Eating pace, try not to eat really quickly. Keep yourself at a decent pace. Some of the patients I work with, when I try to have them slow down their eating pace, I'll ask them to try to eat with their non-dominant hand. And if they're not good with chopsticks, I have chopsticks in my office for them to try, and I'll say, your non-dominant hand with chopsticks, that will slow you down. That's a big factor. People are in a hurry all the time and not as always able to eat mindfully. Keyboard dining, eating while we're standing up, we all do that. Yeah.
And eating while doing something else.
Exactly. Exactly. We're on to the next thing.
And does it tend to run in families?
There's definitely a genetic component to type 2 diabetes, absolutely. And type 1, they're not quite sure about that. It's fairly clear that it's some type of autoimmune disorder, and the body's, body's own cells are actually destroy the pancreas. It could be environmental factors they're not quite sure of yet. Virus, that's what all the research is targeting, and Jean Shaheen's bill should hopefully help broaden that research.
All right, very good. Thank you very much.
Okay, thank
Well, good news to think about during National Nutrition Month as we continue throughout the month of March. Thank you so much, Virginia and Lisa.